Morning, and thank you for joining us today. We are living in extraordinary times. I know each of you has been working hard and been laser focused on responding to the novel coronavirus pandemic. I'm grateful to each of you for the hard work and time that you are putting in every day to make sure that we are keeping the region moving. Thanks to you, we are helping critical personnel get where they need to be. Doctors, nurses, police officers, firefighters, transit workers, and other first responders, as we all come together to navigate and respond to this extraordinary public health crisis. I know our entire leadership team, including each of our agency presidents, join me in thanking you, as does New York. Even the New York Post, a frequent critic of the MTA, this morning gave a call out to all transit workers for showing up to keep New Yorkers moving. I'm joined today by Chief Operating Officer Mario Peliquin, Chief Employee Relations and Administrative Officer Anita Miller, Chief People Officer Paul Fama, Corporate Occupational Health Officer Dr. Daria Luisi, and Chief Safety Officer Pat Warren. This is the first employee information session that we're holding, but there will be more to come. We know this is a unique time, that the situation is rapidly changing, and new guidance and information is coming out regularly. And we know that you have questions and concerns. We're working around the clock to make sure that we're on top of the newest developments and doing everything we can to keep each of you and our customers healthy and safe. Every part of our society and economy will be challenged and stressed in the coming months as a result of this pandemic. I am certain that our country, state, and city, and the MTA will emerge from this crisis, and in the case of the MTA, having served and continuing to move millions of New Yorkers every day. A word about the actions we have taken to protect you, our employees, and our customers. Every action regarding employee, customer health has been driven by advice and direction from the federal CDC, New York State Department of Health Commissioner Dr. Howard Zucker, who I talk to many times a day, to Howard and his colleagues, and his counterpart in the New York City Department of Health. The MTA, this is a national and international crisis. Airlines, hotels, manufacturers, the restaurant down the street, and literally every company and governmental agency in the country, including the MTA, is currently suffering from a liquidity crisis, a fancy term for not having enough cash. In the case of the MTA, this is driven by the fact that our fare box and toll revenue is about $8.5 billion a year in a normal year. That's half of the operating budget needed to run the MTA. I don't need to tell you, ridership has declined precipitously. You all know that. And as a result, fare box and toll revenue has dropped dramatically. We've planned for this day. Bob Ferran, our CFO, put in place a $1 billion line of credit. And we have drawn that line of credit and will receive those funds tomorrow, Friday. We have other rainy day options in place, and we will be utilizing those too when we need to. But to be clear, these are stopgap measures and not a long-term solution. I'll note that the MTA on the operating side spends $300 million a week on a $17 billion budget. We have asked this week the New York congressional delegation on an urgent basis, and the congressional delegation supported New York and the MTA after 9/11 and Superstorm Sandy. We've asked on an urgent basis for $4 billion in federal funding to respond to the pandemic. We were the first transit agency in the nation to do so. We will keep you posted on matters generally, including the federal reaction to our response. I want to say we have no plans to lay off any employee as a result of the pandemic. Frankly, we need each of you to keep the system moving as we help critical first responders get where they need to go. I have been moved by your dedication, day in and day out. Each of you is demonstrating the best of New York, that New York spirit, that grit and determination to move the city and the region through this crisis. It is not an exaggeration to say that you are saving lives every day. A brief word on transformation. Anthony McCorden and his team continue to work on transformation, but on a different timeline. The situation is dynamic as a result right now, as a result of the pandemic, and we're solely focused on employee and customer health and having sufficient numbers of employees to run the system. Transformation will proceed on a timeline that prioritizes getting through the pandemic and the liquidity crisis that has started across the country, including here at the MTA. I'll finish where I started, which is with tremendous thanks and gratitude for all that you do every day, and especially during this extraordinary situation, this pandemic. With that, I'll turn it over to Pat Warren, Chief Safety Officer.
Thank you, Pat. As you know, we have rigorously intensified cleaning protocols across the system, disinfecting all stations and frequent touch points twice daily, and our whole fleet on a 72-hour cycle. Workstations are being disinfected aggressively and frequently. Hand sanitizer is available around all locations, and employees are encouraged to continue practicing good hygiene by frequently washing your hands for 20 seconds and covering your mouth when you cough and sneeze, and practice social distancing when possible. You should also avoid touching your eyes, nose, and mouth. While the system is safe, if you experience symptoms like fever or respiratory issues, please stay home. Please reach out to your supervisor and our employee hotline at 646-252-1010 if you have any questions. I want to take some time now to clarify some of our other policies on this issue. We've suspended the use of biometric finger scanning for all employees. However, you may still need to swipe your card or enter your passcode to clock into work. You should continue to use these same precautions when you touch door handles and other frequently touched surfaces. Regarding working hours, we're continually evaluating our needs. Unless advised by your supervisor, all work at the MTA will continue as scheduled, subject to all existing policies. We know that in every emergency, we have an obligation to our customers and to our employees to ensure safe operations. When it comes to wearing such gear as masks and gloves, these items are not recommended by the CDC as protection against the COVID-19 virus. If this is part of your current personal protective equipment, you should wear them and will be provided them as part of your PPE. However, for any employee who does not have masks or gloves as part of their PPE, you may choose to wear them if you have underlying medical conditions or if this makes you feel more comfortable during this time. Any gloves or masks that are not part of PPE would need to be provided by you. It's important during this time to revisit the guidelines and policies written to keep you safe on the job. These will be reviewed and updated whenever guidance from the public health community recommends a change. And some important reminders: make sure your supervisor has your latest contact information so that we know how to get in touch with you if need be. If you plan to travel for any reason, personal or professional, you must report your plans to your supervisor so we can ensure that we understand and reduce our risks from domestic and international exposure. Thank you. And with that, I'll turn it over to Chief People Officer Paul Fama.
Thanks, Pat. I want you to know that this town hall was designed because we heard from you that you want to hear from us, that what we're doing to protect you and how we're going to control this crisis. We've literally received hundreds of submissions and put together the most frequently asked questions. We will continue to answer your questions, and we will be posting additional information in the form of an FAQ, so please look out for that in the near future. Please also know that our top priority as a leadership team is your health and safety. And we're committed to being as transparent and open with you as possible. We will continue to update you regularly on the situation, and as you know, this is dynamic and will evolve day by day. With that, let's go to some of your questions that you were so generous to share with us. The first one: will the system shut down or will service be reduced because of the pandemic?
So, Paul, the system is not going to shut down. We are carrying millions of New Yorkers, even at reduced ridership levels. Many of those people are first responders, police officers, firefighters, transit workers, doctors, nurses, healthcare professionals, utility workers. The list is long. We take the responsibility to move those people to and from their jobs and back to home safely. We will continue to do that. The MTA has got contingency plans for basically everything. We are looking at service as if and when we make adjustments. We will communicate with our employees, to union leaders, of course, to our customers and the public.
Great, thanks. The next couple questions were about notification procedures, which I know there's been a lot of policies from us, from the state, from national organizations. But this question is, what is the procedure for notifying the MTA about confirmed cases? How do I call in to say I was tested?
Okay, I'll take that. So there's a couple steps that we ask each employee and supervisor to look at. First one is that you should call our hotline, and the hotline really just became active this morning. And the number, again, I'll repeat it, is 646-252-1010. Again, 646-252-1010. And they'll be able to give you instructions and guidance based on what your situation is. The second thing we ask you to do is contact your supervisor. This is really important for a couple, three reasons. One, so they know where you are. Two, so they can adjust work based on the fact that you're absent and somebody else is going to need to cover for you. And the third thing is so that we can know who else was in your environment perhaps, and if they need to be tested or be talked to by a healthcare provider, we're going to make that happen too. So really important that you get a hold of your supervisor. I'll just stress that each individual's situation is different, and that's why there's no cookie cutter answer to this in terms of what you will be told to do, but our healthcare providers who are working at OHS are really doing a great job, Herculean effort, trying to make sure that you get the best guidance that you can. And we ask that you be patient with them as they try to get to the literally hundreds of calls that are coming in.
I just want to follow up with that. We do have nurses that are manning the hotline. We are available. I also just want to stress, if you're not feeling well, please call your healthcare provider or your personal physician. I also think there's other information out there that you should be connected to. The Department of Health for New York City, 311, the New York State Healthline, which is 1-888-364-3065. All of those resources are resources that our staff are supporting in trying to help people understand what their next steps will be.
Great, thank you. Pat and Dr. Louisi, your teams have just been extraordinary to set up these hotlines and provide information, almost 24/7. So thanks for everything that you're doing. The next set of questions has to do with testing. Lots of questions on testing. So this question is, will MTA eventually provide virus testing for employees? If so, when and where?
So I'll take that one. First, greetings to all of the MTA family that's participating and others who are watching this morning. The answer to that question is no. It's important to note, at least not at this time, it's important to note that our occupational health services, which is staffed by incredible physicians and RNs and lab techs, the fact of the matter is that they're not a treating source. So the best place for you to get advice as to testing is to contact your treating physician or treating facility. There's also a 1-800 number that you can see if you're eligible to go for the drive-through testing that the state has set up in various locations. And you'll describe what your symptoms are, and they will determine whether or not it's appropriate for you to be tested at this time.
Great, a very important distinction. The next question is, what is MTA doing to protect employees who have an underlying medical condition? For example, people with asthma and diabetes.
I'll start off with that one. So first thing is, what we're doing for every employee is we're making sure that we clean and disinfect the facilities every day. So and as well as the cars, the rolling stock, and the stations out there. So that's for everybody, and that's also for these people in these high-risk categories that we just described. The second thing is that those individuals who have those underlying health conditions need to continue to follow the guidance that their medical professionals, their doctors have given them all along. So if they're required to take certain kinds of medicines, et cetera, they should be doing that. If they're required to wear certain kinds of equipment or PPE, they should be doing that. So all those steps should be addressed as you go forward. If there's something new or something that based on this virus that you are concerned about, you certainly should once again get in touch with your healthcare provider and find out what more you might be suggested to do. So that's what's going on in terms of how we are handling our folks that are at higher risk.
Great. So the next group of questions has to do with protection and cleaning, which I know many of you have been involved directly in helping us keep buses, subways, and trains to the standards that we expect. So the first question is, how is the MTA ensuring that all trains and buses are being cleaned according to the new intensified protocols?
Thanks, Paul. I'll take this one. First, I need to say that we're taking this whole approach of disinfecting very seriously. We have a very aggressive approach, delivering the sanitization program that we've put on early when COVID-19 surfaced. So we have very diligent protocols in place, and the cleaning is scheduled, very, very closely. We're cleaning all the stations twice a day, and every piece of rolling stock at least on a 72-hour rotation. Some are getting touched more often than that. The public health depends on that, and also our employees' health. And we're also starting to look now at innovative solutions to disinfect and to provide protection for longer periods of time.
Right. Great. Yeah, the next question is one where our MTA family is not exempt from contracting the virus. We've had several cases, people are quarantined, others have symptoms. So this next question is, what is the MTA doing to protect and disinfect work areas of an infected employee who may have touched surfaces around their work area?
Yeah, Paul, I'll take that one too. Certainly there's office work areas, and then there's depots and other kinds of work, or actually working on trains, et cetera, and so, and buses. What we're doing is that, let's start with the office work areas. Office work areas are being disinfected every day, and want to stress this to folks who think that there's an issue in their work area, they should contact their maintenance folks that are in the building there, and if they don't know, they should get their supervisor, and they'll help them get in contact with them. And they are very aggressive, and my hat's off to those folks who are working maintenance. I mean, they are really very aggressive in getting to those locations very quickly and getting them disinfected. So we should, when you see them, you should give them a pat on the back, because they're doing a great job. It's similar though for also, you just heard about the rolling stock and the stations. Those are being cleaned, not only the customer areas, but also the areas where our employees work. So in the similar cycle that was just described by the Chief Operating Officer. The last area are like depots and yards and those kinds of locations, and it's similar to what's going on in the office buildings. Those places that are common areas, in particular restrooms, kitchens, break areas, elevators, vestibules, et cetera, are being disinfected daily. And again, if you have an area that is that you think because someone was ill or some other issue came about, again, quickly notify your leadership, and they'll get a maintenance team in there.
Terrific. Thanks, Pat. Another question which we've heard a lot about, because there's a lot of controversy over these subjects, is the MTA providing masks and gloves for our safety? Nita, do you want to start?
Sure, I'll kick this one off. So yes, first and foremost, and I'll underscore what Patrick Warren said at the top of his comments, is that yes, we are providing all the appropriate PPE equipment to all of our employees first and foremost. In addition to that, while it may not be recommended for employees in certain crafts to wear masks or gloves, we realize that because of this crisis, and people will feel more comfortable if they have that, we're allowing them to wear those at their at their desire. That's where we are as a policy.
And I'll just reiterate that, again, if it's part of your PPE, we're making sure that you have that, and talk to your supervision if there's some question about that. But if it's not part of your PPE, it's voluntary, and you need to provide them yourself at this point in time. Again, not recommended.
I would like to say that the CDC has still not recommended that we provide masks to people that are healthy. They are really recommending that someone that's wearing a mask to be careful, be cautious with it, because if you continue to touch the mask, you could make yourself more vulnerable to the virus.
Great, thank you. The next couple of questions regard social distancing, which again, there's been a lot of guidance out, and I stress the word guidance as we understand what this policy means for us who are emergency responders. But the question is, should I be concerned about commuting to work on our system?
The answer is no. My colleagues around the table and I are commuting. I was on the 617 from Port Washington this morning, met Lou, who's friendliest conductor on the Long Island Railroad. Got off at Penn Station, took the 2 from Penn to Chambers, and got the 1 to Rector. Everybody around the table, we're not going to go through them, has got their own commuting story. The system is safe. If you're sick, if you have a fever or a compromised immune system, you shouldn't be taking public transit at this point in any place in the country, and you shouldn't be in a crowded situation. But for those who can't telecommute, and especially for first responders, the system is safe. We have increased substantially the frequency and intensity of disinfecting MTA workplaces, stations twice a day, subway cars, Metro North and Long Island Railroad cars, buses, and paratransit vehicles. Obviously, the rules that each of our mothers taught us when we were children, which is to wash your hands frequently, don't sneeze into your hand. The basic rules of hygiene are extraordinarily important. You can't wash your hands enough. If you go out and you touch, objects rather, you ought to wash your hands before, immediately when you get back to your office or home. Use of hand sanitizer is strongly advised. That material is around MTA workplaces. You ought to think about carrying it on your own. But is the system safe? Yes.
Great. All right. The next question, again about social distancing, is how can the principles of social distancing be applied in office and field work?
So we just heard the discussion about when you're out in the public and sort of on your own time, and I think New Yorkers are doing a good job about trying to maintain social distancing, and I applaud everybody for that and what's going on. But sometimes your job just doesn't, what your task that you're supposed to do does not lend itself to the social distancing of 6 feet that we're talking about. And so in those cases, you need to continue to do your job, because it's critically important for New York City and all the first responders and the healthcare providers, et cetera, and the people who work at Con Ed and get you power every day and the water utilities, et cetera, to make sure that they get to work and that we continue our system, keep the system in New York City working. The second part of that is you, again, use good hygiene at the end of each one of those encounters. So if you have to use a piece of equipment or ride in a vehicle that social distancing is just not feasible, when you get out, make sure you wash your hands, use hand sanitizer and the like. And if you are ill, as was pointed out, you shouldn't be getting into those you shouldn't even be coming to work.
Right.
Yeah, Pat, I'll add to that a little bit. Some of our employees have client-facing roles that are important, and we've taken some steps to help with that because the work needs to continue, the trains need to keep rolling. So in addition to disinfecting, the rolling stock and so on for our customers, we're disinfecting the vehicles that we use to carry our crews around, and that's important. Also, we've stopped handling cash on the 2 railroads, and also we've distributed gloves to the conductors on those trains because they often have to touch tickets or cards and things like that. So in an effort to be extra safe, we've taken those measures in addition to what Pat just explained.
And just to jump in, did we also mention that we're also encouraging the customers to utilize our apps wherever possible on the trains, right, and to avoid, exchanging money?
Absolutely. Here's some questions that are less about the system and more about our employees and what they're worried about. This question is, if I get sick and have to isolate beyond the 2-week approval, will my job be protected? Will I have to use my accrued leave time?
So the answer to the first question is yes, your job will be protected. Up to the 14 days you are, not being charged your time, and pursuant to our own MTA policies, as well as legislation that has been passed and/or is pending, your job is going to be protected. So that's fine, depending on what your circumstances are. So let's say you are fortunate enough that you are tested and that your test comes back negative. That's great news. But you may still be suffering from some other challenges. If that's the case, you'll report that to Human Resources like you typically would. And then if it's appropriate, that you would be charged your sick time. But first and foremost, you'll contact your treating source, HR, and then we'll take it from there.
Terrific, thanks. Next question is, what steps will be taken to ensure that employees can travel to work in the case of a shelter-in-place order?
First of all, it's important to note that there's no order to limit travel at this time. In order to be prepared, and part of our emergency preparedness plans, I've issued a letter yesterday that's being distributed now that, together with a piece of ID that shows that you're a transit employee, will allow you to travel to your workplace in case that anything more strict comes down. But we haven't heard that there's anything like that coming up anytime soon. If it gets to that, we just want to make sure that you can continue to make your way to work, because the work that you do every day is invaluable to all the first responders that Pat touched on earlier, and it shows the dedication that our employees show every day.
Thank you. The next question has to do, and we had received a lot of questions about this one, is in my workplace. What do I do if one of my close coworkers has symptoms? Should I self-isolate?
I'll start off and on that one. Similar to if you yourself are sick, you should contact your supervisor and contact the hotline and get some instructions at that point. If in fact, if you're home, you should stay home until you get that kind of guidance. If you're at work, again, you need to get with your supervisor and talk that through, and then they'll get some instructions at that point.
Yes, I'd just like to add one thing. I think currently the data is showing that 80% of the cases of folks that are identified with COVID-19 positive are mild. So we do want you to take the time to reach out to the hotline for the Occupational Health Department and speak with our fully staffed and trained employees to find guidance on what you should do, along with the HR and your supervisor.
Our hardworking employees also want to know something about vacation time. And the question here is, I plan to use vacation time to travel before this situation intensified. Should I cancel my upcoming trip? Do I need to report my plans to the MTA?
Well, obviously, whether or not you choose to cancel your trip is a personal decision. Hopefully, you're keeping track of what's happening and what the news is posting in terms of safe places to travel to or to not travel to, or that you're precluded from traveling to. Having said that, we need to know when you're traveling. We need you to report that to your supervisor and to HR so that we can keep you safe and your coworkers safe.
I think something else that's been coming up a lot of employees have asked us about gatherings, family parties, or other celebrations, and we've really been trying to advise people to maybe rethink that. I know it can be difficult when you have pre-plans that have already been set up. I do think that you should take caution in gathering.
Great, thank you. Another question comes from, our MTA family has families too, so childcare is a big issue. The question is, schools citywide have been closed. What am I supposed to do regarding childcare if I'm an essential employee?
Great question. So many of you may have already heard that the city is kicking off what they're referring to as an enrichment program. As you know, the city schools have been closed due to this health crisis, but the good news is that they're converting those schools into locations where they can receive children and make sure that they're engaged throughout the day. The hours, as I understand it, will be from 7:30 a.m. to 6 p.m. each evening. It will be within 100 locations across all 5 boroughs, so that's great. Right now, we are having direct conversations with the city's Department of Education so that we can drill down on how many of our employees, frontline first and foremost, that will be able to take advantage of this. We should be, by the end of the day, posting information as to how employees can access this. We're working with our labor partners, the unions, so that we can push this information out to employees as quickly as possible, and just keep posted, and we'll keep you informed with information.
Anita, thinking of talking about our labor partners, Yeah, how's it working with the unions today?
I've got to tell you, I mean, it comes as no surprise to most of us who have been in the MTA family for a few years now. Our labor unions and their members, who are our employees, always rise to the occasion, step up, whether it's a snowstorm, a hurricane, a blackout. Although this crisis is a lot different in a lot of ways, the good news is that they continue to step up and work with us. Our agency presidents, our labor relations leads across every the MTA family is in direct contact with our labor unions. Oftentimes, they're our best line of communication with the employees because they're hearing it first. You know, their members actually will call them and say, "What should I do?" And so the good news is that so long as we're keeping that line of communication open, we can make sure we can communicate all the appropriate information to our employees.
Right. I've been here a short time, but I am amazed and thrilled that we have that level of cooperation, and we'll need to continue it, you know, now and in the future. Next question is a question we get often asked, even though we use the term a lot: essential employees. How is the MTA classifying essential employees today?
I'll take this one, Paul. The state defines an essential employee as anyone whose job function is essential to the effective operation of their agency or authority, or who must be physically present to perform their job, or anyone who's involved in the COVID-19 emergency response. So what we do here, you know, we use common sense also, so it makes sense that transit employees, operators, maintenance staff, and so on are essential. There is also a designation that we've made for a whole series of other employees at the MTA and the agencies. As Pat explained before, critical infrastructure needs to continue operating in the city and in the region, and having a reliable transit is very important to deliver that service. That's very important service. So the designation is out there, and a lot of our staff is designated as essential. And then some people that are also designated as essential do not have to come to work, and we've made that clear to those people because of the tools that we talked about before that allow working remotely.
Great, thank you. Another often asked question was, should I stay home if a family member is sick?
So occupational health has been receiving a lot of these questions. Our advice at this point is if a family member is sick, we do advise you to stay home. Each of these cases are handled on an individual basis. Our occupational health staff would reach out to you, or you could call the 800 number 646-252-1010 and seek advice. But again, each case is handled differently. Some family members may be living in close proximity within the family. Other family members may not be. And so our nurses would like to speak with you and get some individual information.
Great. And our last question that we've summarized for you today is regarding telecommuting. And it is, if we do not have the equipment to work from home, how does that affect our jobs? Will the MTA provide me with a laptop?
So again, that's case by case. Obviously, if you're signing up for teleworking from home, we will try as best as possible and based on availability to make sure that you have everything that you need to perform your work at home. If, however, you do have a computer or you have resources that you can access, we encourage you to do that. You would be in contact with, through your supervisor with IT to make sure that anything that you're using, for example, if you have to access the MTA's system, we want to make sure that it's safe from security purposes, right? But we'll do the best to make sure that you have everything that you need to do to perform your work at home.
Anything else? Okay. All right, good. Well, this concludes our Q&A. I'd like to first thank all our leaders today for your candid and answers to many tough questions, and we'll be fielding more. We'll follow up with all the other unanswered questions and post them as soon as we can. So now I'd like to turn it back over to Pat Foy for closing remarks.
Thank you, Paul. I want to thank each of you for your hard, dedicated, gritty, and frankly, life-saving work over the past couple of weeks. It's been extraordinary. New Yorkers of all kinds recognize it, and thank you for it. You are doing literally life-saving work, because the people that we are transporting are first responders and people who treat, care, and move New York, including transit workers. This is obviously a fluid situation. We will do more of these briefings, and we'll be communicating additionally going forward. I want to end on 2 points. One is Governor Cuomo has been clear that the MTA is not going to shut down. We are not going to shut down. We're going to continue to carry essential personnel to do their life-saving work and to keep this city and region and state moving. We'll also keep you posted on directives and advice from Governor Cuomo's office, also with respect to the city of New York, the counties, and for those who ride west of Hudson, New Jersey, to the extent that's appropriate, as well as the New Haven line. Thank you for tuning in today. Take care.